A very pleasant afternoon to one and all present here. Today I'm going to discuss about a journal on the topic a tight interplay between platelet activation and mitochondrial DNA release promotes platelet storage lesion in platelet concentrates. I'm Dr. Parvati, JR1, Department of IHBT, MGM. So these are the topics we are going to go through this. Platelet preparation types, metabolic concerns during storage, platelet storage lesions, and we are going to discuss about the journal. Platelet preparation types. We know that there are three methods of platelet preparation. From whole plate, we can either prepare it by PRP method or by Buffy coat method, and we also prepare platelet from platelet pheresis. So, in this whole plate PRP method, what we are doing? First, we are doing soft spin followed by a hard spin, and whereas in the Buffy coat method, we are doing a hard spin followed by a soft spin. And what we routinely do in our department is we are following the PRP method of platelet preparation. In this Buffy coat method, there will be less early activation of platelet during storage as the platelets are centrifuged against a cushion of RBCs rather than a non-physiologic plastic container of PRP method. So, whenever we are preparing a platelet by Buffy coat method, there will be less early activation of platelet. Moving on to metabolic concerns during storage, what are the major metabolic changes during storage? Those are temperature change, metabolic fuel availability, and respiratory capacity changes. So, first, temperature. The normal storage temperature of platelet is 20 to 24 degrees Celsius. Whenever there is a membrane phase transition occurs when platelets are stored below 30 degrees Celsius. So, in this phase, all the phosphoinositol rich lipid rafts come together, resulting in a shape change and intracellular calcium accumulation, leading to activation priming. So, from this figure, what we can see is the lipid rafts. This is the platelet plasma membrane, and these are the lipid rafts present on the membrane. And whenever there is some external stimuli, like physiologic agonists like thrombin or collagen, or whenever the platelets are chilled below 15 degrees Celsius, all these lipid rafts will come together, leading to platelet activation. So, if platelets are stored at cold temperature, there occurs an interaction of glycoprotein 1B alpha, which is a platelet glycoprotein, with von Willebrand factor, which is a blood glycoprotein. What does this lead to? This initiates platelet adhesion and platelet aggregation, ultimately leading to immediate thrombus formation. So, these cold stored platelets, they have the capacity to cause immediate thrombus. But at the same time, these cold stored platelets, in these cold stored platelets, there is an increased apoptosis. So, in this cold stored platelet, there we have immediate hemostasis. So, from this, what we can actually have a point of view like, can this be beneficial after trauma? Because when these cold stored platelets are given, it immediately restores the hemostasis. So, we can actually think, is it beneficial after trauma or not? But the thing is, cold stored platelets are rapidly removed by glycan leptin mediated mechanism by hepatic macrophages. So, cold stored platelets are hemostatically active, but at the same time, their circulatory capacity is shorter. So, what are the advantages of room temperature stored platelets over cold temperature stored platelets? These are the advantages. They are decreased in vitro aging or prolonged survival, slower accumulation of toxic metabolites, and longer duration of circulation. So, this is a graph depicting the circulatory capacity of platelets to the temperature at which it is stored. At around, if the platelets are stored around 18 degrees Celsius, their circulatory capacity will be lost after 24 hours. If stored at 16 degrees Celsius, that capacity goes after 16 hours. At 12 degrees Celsius, it goes after 10 hours. And at 4 degrees Celsius, if it is stored, it goes after 6 hours. Which means when the platelet is stored at very lower temperature, the circulatory capacity is lost very faster. So now we have an idea about the temperature of platelets, which is 20 to 24 degrees Celsius. And what are the advantages of room temperature stored platelets over cold temperature stored platelets? Moving on to metabolic fuel availability, we know that energy currency of cell is ATP, and other fuels which can act as energy fuels are free fatty acid from the plasma triglyceride, amino acid glutamine, acetate in platelet additive solutions. These are some of the energy currencies. So we have to know about pressure effect. This pressure effect is the cellular presence of oxygen results in decrease in rate of glycolysis and ultimately leads to suppression of lactate accumulation. So whenever there is oxygen present, there will be less lactate accumulation. That is the point here. So there will be aerobic and anaerobic metabolism taking place in stored platelets. Most of the time, aerobic metabolism occurs whenever platelets are agitated. So in continuously agitated platelet concentrates, 85% of the time aerobic metabolism occurs through TCA cycle and oxidative phosphorylation. In that, 13 moles of ATP are produced per mole of acetic acid. Moving on to anaerobic metabolism. So the remaining 15%, there will be anaerobic metabolism. We have to know about pressure effect. What is this pressure effect again? Whenever there is oxygen, there occurs a less lactic acid accumulation. So with this in mind, in this anaerobic metabolism, there is less oxygen. So what will happen? Glucose, there will be increased glycolysis. Because of pressure effect, there will be increased glycolysis and glucose will be converted to pyruvic acid. And this pyruvic acid, instead of getting converted into acetic acid in the presence of pyruvate dehydrogenase, this usually occurs in aerobic metabolism cycle. So here there is no oxygen. So instead of going to acetic acid, it gets converted into lactate. So in the presence of plasma bicarbonate, this lactate gets converted into carbon dioxide and water. So there will be less lactate accumulation. Whenever there is plasma bicarbonate, this lactate will not accumulate because it is getting converted into its byproducts. So once the plasma bicarbonate is depleted, there occurs the problem. So once this plasma bicarbonate depleted, lactate is accumulated, leading to fallen pH. So when this lactic acid is getting accumulated, there will be a decrease in pH. So the normal pH for platelet storage is 6.4 to 7.4. If pH falls below 6.2, there occurs an irreversible damage. So what are these damages? There will be loss of platelet viability. The platelet will swell, leading to shape transformation. There occurs a loss of membrane integrity and loss of swelling effect of platelet occurs. After 7 days, adenine depletion present in the adenine which is present in platelet will also get depleted to less than 70% of the previous value, leading to platelet senescence and necrosis. So this pH part also we have gone through. The last part is respiratory capacity. For maintaining aerobic metabolism, which is around 85%, the platelets should have a partial pressure of oxygen more than 5 to 10 mmHg. And if there is more content of PC in the PC bag, the platelet bag permeability will also decrease. And if partial pressure of oxygen declines, what happens? This glycolysis increases and lactic acid accumulation occurs, leading to a fall in pH. This is again pressure effect. And this depends on every manufacturing company's bag actually, based on the bag's wall thickness, the volume surface area of bag, and continuous agitation which we are placing here. So what does this accumulation cause to the platelets? It facilitates oxygen utilization by the platelet mitochondria. It prevents settling down of platelet. Also, if this agitation is not done, the platelet contact mediated switch from oxidative to glycolytic metabolism occurs. That is it will change from aerobic metabolism to anaerobic metabolism if agitation is not done properly. But there is one fact in ROSI that agitation can be safely interrupted for 24 hours without undue lactate accumulation and subsequent development of low pH. That it is saying that if we are not agitating it, there won't be any changes in pH. This is just a fact given in ROSI. So we now know about what are the changes that occurs during platelet storage. A brief overview about platelet storage lesion. What is platelet storage lesion? This is the progressive decline in function, and morphological changes that occurs in platelet during storage. So what occurs in during storage? Shape changes from normal discoid shape to sphere formation. Here is a scoring for it, which is known as Kunicki scoring system of platelets. 4 score is given for the normal disc shape, 2 for sphere, 1 for dendritic shape, and 0 for ballooned out platelets. What other changes occur? Mean platelet volume decreases throughout the storage. So what does this mean platelet volume signifies? It signifies the size change in platelet. So the platelet, the size of the platelet eventually decreases throughout the storage. And upon storage, platelet undergoes activation, leading to release of intracellular granules. Whatever granules present inside, it will just release platelet factor 4, beta thromboglobulin, T selectin, CD63. All these release upon activation of platelet. And surface expression of membrane phosphatidyl serine, which is a marker of platelet procoagulant activity. So these are the changes that occur, which are collectively called as platelet storage lesions. A single word about this platelet additive solution. There are two generations, first generation and second generation. First generation, we have PVC diethyl hexyl phthalate. Second generation containers, they have polyolefin ethylene vinyl acetate, totem bags, and BTHC bags. So what are these platelet additive solutions uses? They provide greater plasma recovery from the whole blood. They have minimalization of adverse effects of plasma like allergy and febrile non-hemolytic transfusion reactions, decrease ABO isoagglutinin mediated hemolysis, and they have decreased chance of antibody mediated trial. Now that we have discussed some points about this platelet storage lesions, we can go into the journal proper. This journal I have taken it from Vox Sanguinis, the International Journal of Transfusion Medicine. The editor-in-chief is Professor Dr. Michael Lozano, Barcelona, Spain. The impact factor for this journal as on May 2024 is 1.8. This is an original article, a tight interplay between platelet activation and mitochondrial DNA release promotes platelet storage lesion in platelet concentrates, given by Professor Dr. Kamed Heri, Shahram Sami, Fayman Beji, Smerdis Hajati, and Mohammad Reza Dehim. It is in volume 119, issue 5, pages 439 to 446, published on May 2024. So, introduction. Let us go into the journal step by step. So these things we already know that they are telling that whenever platelet is stored, there occurs platelet activation and platelet storage lesion. So what else they have said is this stored platelet undergoes activation, increasing which leads to an increase in P-selectin surface marker, which is CD62P expression. Here they are going to concentrate in this journal throughout on this P-selectin marker, which is CD62P. Also, they have said that if CD62P is present, it implies that there will be reduced survival of platelet, fast clearance of platelet from circulation, and it may or may not be associated with TRALI. So this CD62P is a marker of platelet activation. Then again, what they are telling is whenever there is activation of platelet, the mitochondria is released out of the cell. So this mitochondria, it serves as a substrate for bactericidal secreted phospholipase A22A. This phospholipase, it is an enzyme